Hello and welcome everyone, and thanks for joining today's webinar with Invictus Marketing Solutions. Oh, did you just take over my screen?
I'm so sorry.
That's okay.
My bad. I got a little ahead of myself. Sorry, Laura. I could go back.
I'm like, wait, what just happened? I'm trying to introduce you guys. You're taking my spotlight away. All right, we'll start all over. Welcome everyone, and thanks for joining today's webinar with Invictus Marketing Solutions. This is going to be a great webinar with the Invictus team. All you need to learn is how to rise through this craziness in today's marketplace. So you're going to learn how to generate some additional income through the Invictus team. The chat is open, so please ask your questions, raise your hands. We will open up your mics for you. So today, the Invictus team, I know it says 2024, Cody's going to scream at me, but today they're going to be going over what Invictus Marketing Solution can do for you. So today with us, we have Scott. Scott, if you would like to tell us a little bit about yourself, how you got involved with Invictus, and then introduce your team, that would be great.
Perfect. Yeah. So my name is Scott Amos with Invictus Marketing Solutions. I'm the co-founder and managing partner. I have been in the Medicare space for about 16 years. I started out in the property and casualty with a captive company, just like most of you guys. So I kind of know where you guys are coming from, right? So I've owned a property and casualty agency also for about 12 years. I realized pretty quickly that I needed to diversify, and so started into Medicare because my grandma needed a Part D plan. So I will I'll tell a little bit more about that story here in just a little bit, and introduce the next person. So.
Hey, I'm Travis LePage. I'm the other co-founder of Invictus. My background started when I was 22. I was a PNC agent. I was with Farmers Insurance for, well, too long. Went captive, had a successful captive agency, but I really enjoyed doing this and working with agents to kind of help them show how to diversify their agencies and ever progressing wheel of who knows what. We just
right.
so we're going to learn how to diversify. I'm going to share the secrets with you. If you have any questions, we're here to answer for you.
Wonderful. Thank you.
Hi, everybody. I'm Cody Amos. I may look similar to and share a last name with Scott. I'm actually his son. I've been working with Invictus for about 9 years now. I started selling insurance when I was 19, and now I help handle all the contracting and get everyone set up and ready to sell. So that way you can diversify your agency through Medicare.
Wonderful. Thank you. Welcome, Cody.
Thank you.
Hi, Mark.
How are you?
Great.
I'm Mark Nienhuser, Guardian Insurance Group as NOAA agent out of Lake of the Ozarks, Camdenton area. I met Scott and Travis through the PNC side when I was actually a farmer's agent for a small amount of time. And through that association, came across Medicare. And there has not been one thing that has helped us grow our PNC shop now as organic as Medicare has been than our Medicare business. So talked to Scott and said, I think this is something that everybody should at least take a look at. And so that's how my relationship with Scott and Travis and Cody came about.
Well, thanks, Mark. Welcome. All right, Scott, if you would like to share your screen and go ahead and kick us off today.
All right. So kind of have some introductions here, but now you kind of know us a little bit. We'll kind of go over kind of our future, right? So kind of why we need to get into the Medicare space, the health insurance space. We've been working with as no agents for about 3 years now, and so just to kind of look at our future, right? So I like to put numbers to things of just kind of, hey, per town, just to kind of look around at your grocery stores, at your book of business, and see how many people that are actually on Medicare. But the numbers of individuals on Medicare is estimated to grow to 79 million people by 2030. There's 11,000 baby boomers are aging into Medicare every day. In 2024, that's looking more like about 14,000 people aging in. Wouldn't you say, Mark?
Absolutely. Can you make that a little bit bigger, Scott? That square.
Let me see here.
I
Like-
see an arm.
Yeah.
Let me share this again.
Okay.
Sorry, guys. Is
We'll let you know when it comes up.
that better?
Perfect. There you go.
All right. Thank you, Mark. So yes, I mean, there's a heck of an opportunity. So 14,000 baby boomers aging in every day. There's over 65 million people that are enrolled in Medicare now, and almost 34 million are enrolled in original Medicare. So just kind of show you the opportunity. 32 million are enrolled in Medicare Advantage or other health plans. Okay. So when somebody first comes to the office, we ask them to get out their Medicare card. So it's going to be that red, white, and blue card. It's going to have their name on it. It's going to have a unique number. So it's going to be a unique plan to them. Okay, so it's going to have two parts of Medicare, Part A and Part B. And Part A is going to be our hospital and skilled nursing facility. Typically, they're not going to pay anything for that Part A as long as they've worked enough quarters, 40 quarters or 10 years. Part B is what we're going to elect to have when we turn 65 or been disabled for 24 months. So there's lots of people that are on Medicare that aren't over the age of 65. Now we're electing to have that, so most people are going to pay $174.70 for 2024, and that's going to cover our doctors and durable medical equipment. Okay, so let's just say I go in for open heart surgery. Okay, the moment that I wheel me in there, I'm going to have that $1,632 deductible for our hospital or facility charge. Part B is going to be a $240 deductible per year, and then 20%. Okay, so to do easy math, let's say that open heart surgery costs $100,000. Okay, that means I'd be responsible for 20 grand. Okay, let's say I have $1 million in chemo treatment. That means I'm going to be responsible for $200,000. Or I don't know about you, but I don't have that just laying around to give to the hospital, right? Okay, and this is where we kind of come into play. We need to protect our people, okay, because original Medicare is one of the only health insurances that does not have a max out of pocket. They will keep paying and paying and paying. So we're going to put something together with that, hence a Medicare supplement. We always kind of call that our Cadillac plan, right? Okay, so with a Cadillac comes with a premium, but typically we're going to look at either like a Plan F or Plan G. So if we look at a Plan F and we go back to that $100,000 open heart surgery, our Plan F is going to pick up that $1,632 deductible, that $240 deductible per year, and then 20% coinsurance. Okay. So when we get home from the hospital, that Medicare supplement is going to pick up everything. So Medicare supplements are great, but that price goes up every year. And we have to also add a Part D plan with that. So a standalone prescription drug plan. So those plans run anywhere from $5.80 to $116 a month. You're going to have a premium, you're going to have co-pays, co-insurance, and sometimes a deductible. Okay. So that's going to be option number one. So, when we're on our group insurance, we have a couple different options. And then when we get to Medicare, it just seems like they throw all kinds of mail and phone calls at your clients. And so they get really confused. Really, there's two different options of Medicare. So option number one is going to be our original Medicare, our supplement plan, and our Part D plan. Option number two is going to be what we call as Medicare Advantage, and it's going to be a private health insurance company like United Healthcare, Anthem, Humana, and Aetna. Okay, that covers your Part A, B, and D all together. Okay, so we call that Part C of Medicare. Now this is going to look a little familiar. You may have a premium, you may have some co-pays when you go to the doctor, you may have co-insurance, but the best thing about a Medicare Advantage plan is it has a max out of pocket. Okay, so it has a worst case scenario. And that may look like anywhere from $3,000 to $5,000, depending on your area. Now, it is a private health insurance company, so there are some rules that we have to follow. So there's HMOs, which is a health maintenance organization, which means that we have a network of doctors that we have to go to. We also have PPOs, which have in-network and out-of-network benefits. But these plans are also offer some dental, vision, hearing, and over-the-counter benefits that you don't get with the original Medicare Supplement option. Okay, so with this, and this is probably the biggest thing, right? So I didn't say it would be easy. I said it'd be worth it. Okay. With Medicare, I want you to think of it as a completely separate line of business. Okay. So if y'all ever started in the commercial business, it's a little bit different than the property and casualty, right? Or the personal lines. There's some things that we have to learn. And so that's what this is going to be too. So we have to take a general certification and certifications for each carrier. And it can be a little daunting, especially the first year. Okay. But we're here to help you walk through that. And the reason why I say it is because then we get to get the fun part, right? The commissions, how we get paid. Okay. So on Medicare Supplement, you're looking at 20% of annualized premium. Okay. So kind of paid out like life insurance, and it's typically going to pay out as earned for the next 6 years, as long as they're on the plan. And then we've got new to Medicare Advantage plans, which is going to be paid in 2024 at $611 for somebody that's new to Medicare. If we're actually switching that Medicare Advantage plan, so let's get to annual enrollment period. So from October 15th to December 7th for a January 1 effective date. And we move them from United Healthcare to, let's say, Humana. On the first week in January, we're going to get paid that $305. The greatest thing about this is these plans renew every year. Okay, so the renewal for Medicare Advantage plans, so we write a plan in 2024 and it renews in 2025. There's nothing that we need to do. It's going to roll right on over, and we're going to get paid out for $305 for that full year, or about $25 per month as earned. Now, new to prescription drug plan is going to be, for somebody new to prescription drugs, it's going to be $100 for commission. And then a Part D to Part D and renewal is going to be paid out at $50 for 2024. Mark, how long does it take you to do a liability only auto? I know you don't do too many of them anymore, but
Well, it takes a lot longer than doing one of these, I can tell you that.
exactly. So I know some Medicare agents that don't even do Part D plans because they don't make enough money. But I know us property and casualty people, when I think about a liability only auto, $100 isn't bad in commissions for the year. So
Yeah.
So I ran some numbers here coming up, just as kind of a average agent. So we're hoping that you do way more than this, but the really great thing is that you're going to have every tool in the toolbox. So renewals, after 1 year, an agent can expect about a 95% renewal retention rate, right? So we help train you on how to talk to your clients about how to do the renewals for the next year. We can help you send out letters, things like that. So we got year one as an agent. Okay, agent writes 30 policies. Okay, during annual enrollment. 20 new to the Advantage gives you a total commission first year of $12,220. 10 new to the agent with Advantage plans is going to be $3,050. Total commissions to the agency is going to be around $15,000. Not bad for 20 to 30 hours worth of certification. Okay, year three commission, we're getting a little bit better at it. Agent writes 75 policies. Total policies 150. 50 new to Advantage plans. Got about $30,000 in commissions during AEP. 25 new to the agent. We got about $7,600. 75 renewals, $22,575. Total commission to the agency about $60,000. Okay, not bad.
Not bad at all.
Year five, we're doing a little bit better. Agent writes 100 policies during annual enrollment period. We have a total of 323 policies, 50 new to Advantage plans, 50 new to the agent. We got 223 policies renewing. We got 67,000 coming into the agency. Total commissions to the agency of around 113,000. this is where like Mark and I talk about, a lot, especially right after annual enrollment period. We love new business, right? Uh, right around $45,000 check during annual enrollment period is not bad to pay those Christmas credit cards off. But I love seeing the renewal checks starting to come in January of what we wrote for the last year, right? It really starts growing. So, $100,000 coming in renewal, this can be a really great business. We just need to look in your book of business. Mark, wouldn't you agree?
Absolutely. Yep.
Hey, Scott, can you go back to that screen that showed the 1 year?
Yeah.
There we go.
Absolutely.
Dustin was asking to see that one again.
Yeah. Like I said, this is just first year commission. So, like if we get started now, and we get a few underneath our belt, and then we can really mine our book of business, this is pretty attainable. Okay. So why Medicare now? I mean, I don't think I need to tell you guys about diversification, right? I know everybody probably on this call is being beat up right now on the property and casualty front. Okay, we work with a lot of property and casualty agents all over the country, and it's just brutal on you guys right now. So we like to say have a little bit of diversification, so then that way we can kind of weather the storm, and be able to pivot. The other thing is this kind of the comfort is the killer of progress. I love quotes. Okay. This came from Eric Bieniemy of the Kansas City Chiefs. We're big Kansas City Chiefs fans here, so don't hate us. I think this is a good one. Like with everybody, we kind of get comfortable in our own position, right? So whether we're in our agency and we're worried so much that we're going to lose business, and the smartest thing that somebody told me is like, we need to worry about retention, but we also need to worry about new business, so, getting out of our comfort zone. I just talked to somebody just a half an hour ago that's been in the business for 21 years. That's jumping into the Medicare business. And he's like, this is all foreign to me. And I'm like, it will be for a little while. 95% of the people are going to fit into a box. The other 5%, you're going to need our help. Okay. And that's what we're here for. We've got Mark, we've got Travis, we've got Cody on the line here. We've got a lot of experience here, so I don't know how many apps Mark's done, but I've kind of counted mine up. I've probably done a little over 4,000 apps in my time, so there's not too much you can throw at me that I haven't seen. And here's like the big thing. Okay. Ever since January kicked off, and there's a new CMS final rule that's getting ready to come out, and I just kind of could have made this for us, but disruption is coming, right? So winter's coming, or AEP is coming, right? Disruption is coming, and
Hey,
it is
Scott.
coming. Yeah.
On that, CMS is the regulator. Might kind of go into that
Yeah. So CMS is the Centers for Medicare Services. So they're the ones that kind of regulate this business. Sorry, you guys know how acronyms work, right? So, and we have an acronym sheet for you. But when I talk about disruption, when I think of disruption, I think of to capitalize, right? And I don't think that's a bad term, capitalize on this, so this coming year for 2025, and I don't have all the details, so I'm not going to go into those. But the Part D is having a big disruption, and they're going to cap drugs at $2,000. Okay. So before there was no cap. People could spend whatever on drugs, and they would keep spending and spending. Well, they're going to cap drugs at $2,000, and I don't know about you, but I don't know of any carrier that's willing to lose money. So pricing is going to go up. People are going to be shopping, and this is a good time for you to become their agent. So time is of the essence, right? So June 21st, the general certification of AHIP comes out, and then annual enrollment period starts October 15th. Like I said, you guys are busy in your office, and we want to get you going. And the time to have everything together and to start selling is not October 15th. Would you say, Mark?
No.
Okay.
Absolutely not.
I remember when Mark and I first got started, I'm gonna tell on you just a little bit, but it's kind of like that, right? We waited to almost, we waited almost till October to get going. And, it wasn't until the next year that it really blossomed out that you got a few people underneath you.
That's right.
So we want to get you guys going as fast as possible. We don't want you to do double duty. And that's why Laura's been so nice to do this webinar now for us to preempt, the certifications for the 2025 coming out. But once we get the certifications done for 2025, we'll be ready to sell for 2024. And there's people that are turning 65 every month. Okay. I don't know about you, but I would rather talk to somebody that knows nothing about Medicare, if I don't really know a whole lot, than somebody that's been on Medicare for 10 years and they know the ins and outs and, about Medicare Advantage and MedSup, and they're asking you lots of questions. And usually when somebody's 75 instead of 65, they take that many more medications and they go to that many more doctors, and it's a little bit of a harder process, right? Okay. So why Invictus? So concierge onboarding and contracting. Okay. Lori, I think you kind of talked with us a little bit about how, a person on our contracting team will actually log in with you and help you complete those contracts. Okay. We'll help you get those things set up. We know you're busy in your agency. And so a lot of times people want to do those things at night and, we're trying to get it done. And then our kids have a ball game or something like that. We want you to be able to do that. We log in with you for an hour. We try to knock it out as soon as possible. Maybe a couple step process, but we're gonna help you knock that out so you don't have to sit there and read everything. We have a step-by-step process we follow from how you present to using the technology, how to quote, and then also how to close. Okay. Continuing support. Okay. So we're not here just to throw a product at you. We're here to actually help support you along the way. Okay. Like I said, 95% of the people are going to fit inside of a box. Those other 5%, you're going to be sitting at across the kitchen table. You're going to have Travis and mine and Mark's cell phone number. We're there to help you get through that. Okay. And here's something that you guys probably aren't used to is actually free technology. Okay. So an actual CRM quoting system all in one, we're going to provide for you. Okay. So we have what's called Medicare Center. And so it is where we're going to quote our Medicare Advantage in Part D. And so bear with me. I'm going to hopefully do a live session here, and we're going to enter in some medications so I can show you how easy it really is.
That's awesome. I have a couple questions for you while you're
Yep.
getting that. If a person is on disability,
Mhm.
do they still need to have supplements?
So if they're disabled for 24 months and they're eligible for Medicare, then yes, they would either need to have a Medicare supplement or a Medicare Advantage plan to control that out-of-pocket cost.
Okay, and
Great
you were
question.
talking about different options, so option 1 or option 2.
Yep.
Which one do you guys all advise your clients on?
So really it's about financial risk. And so, like if we're going to do the Cadillac Medicare supplement option, we're going to pay now. So we're going to pay a premium every month. So then that way we don't have a ongoing cost, right? We could do that, or let's just say somebody's pretty healthy and they don't take a lot of medications. They don't go to the doctor a whole lot. We can kind of pay as we go with a Medicare Advantage plan, right? So your Medicare Advantage plan is going to look more like an employer sponsored plan without a deductible. Usually it just has a max out of pocket. So we got copays that add up to that max out of pocket.
Well, thank you.
Yep, absolutely. All right. So here is the technology we use. There's a couple different ones that we were able to use through Medicare Center. One's Medicare Center, one's Medicare app or Medicare Link. One is Medicare app. I like using Medicare app because it's prettier. They both do exactly the same thing. But we can also, the very best thing about this is it saves your data. So if you know anything about seniors, is sometimes they take lots of medications, and so we can get a lot of this prepared before they get in there and be able to put their medications in there. So what I'm going to do first is I'm going to start a new profile.
We got a question while that's popping up. Do the
You
leads
bet.
come from Invictus And are the agencies on call whoever picks up the phone?
Can you please repeat that?
Do the leads come from Invictus?
So the leads are going to come from you guys. I mean, we can actually co-op leads and things like that. More than happy to do that, but we can also help curtail a marketing system for you guys.
And,
So
and guess what I have? I have a report
that's
that
right.
will run your book of business on agents or on clients that are 64 years old.
Yes. All right. So if you don't hear anything from me today on this, if you get started, this is the most valuable thing I will ever tell you. Hit the save button. So if you don't hit the save, the drugs will not save in there. Well, if there's some people on the call that have ever done Medicare before, we're able to send the scope of appointment through Medicare Center as well. And we can actually add medications in there. Okay. So I'm gonna skip down here to medications, just so you guys can kind of see how easy it is. So if we type in here, we got lisinopril. So we got a blood pressure medicine, and I'm just typing in 4 letters, right? So atorvastatin, take cholesterol medication, and we're type 2 diabetic. And we can hit continue. We can pick what pharmacy we want to go to. So let's just say Hy-Vee and then go to plans. That way we can see if it's a preferred or standard pharmacy. So we've got 4 tabs across here, so we can toggle back and forth pretty easily. So we've got Medicare Advantage plans. And we're going to be able to sort those for total estimated cost. We can see all the way down here. So we've got no monthly plan premium, total estimated cost is 0. All 3 of our prescriptions are in the formulary. Hy-Vee is a preferred in-network pharmacy, and our total estimated cost for our drugs are 0. Okay. We can add the quote to send our client a quote, or we can compare those quotes to, like they say, hey, I don't really like Aetna. I'd rather go with United. Okay, well, we can actually send them both quotes there. If we look at just the plan details, this will actually give us kind of those details on the Medicare Advantage plan. So just kind of at a glance, we can become pretty proficient. So if I was explaining a Medicare Advantage plan, I can go, hey, we've got 0 monthly plan premium. There's no deductible. Okay, our max out of pocket is $3,500. Your primary care doctor is going to be 0. Specialist is $30. Okay, if I was in the hospital, it's going to be $295 a day for the first 6 days, and that's going to be all inclusive. So if we go back to that open heart surgery, and Laura, let's say they keep us for 3 days, it's going to cost us $900 for that open heart surgery, not $20,000. Okay, we're not even going to hit our max out of pocket with open heart surgery. Okay, stents or something like that. And we can kind of go down through here also. I mean, as far as like there's eye coverage, so vision, dental, hearing. There's a copay card. So there's some additional benefits for that person to get. And then we can also look up provider directory right from here. And then also we can look at like the summary of benefits to get even more detail for our client. I love to be able to show people this. If we scroll back up, we can look at total estimated cost. And we can actually show them, hey, when you go to Hy-Vee to go to the pharmacy, it's not going to cost you anything to go pick up your medications. Okay. So, any questions there?
Got one question. Should veterans who are in the VA system also apply for Medicare
Absolutely.
Advantage programs?
As long as they have Part B.
As long as they have Part B. And the reason why we always advise for people that have VA benefits to get Part B as well is because, have you ever heard anything bad about the VA being able to get into the hospital? Or, hey, what if they need a second opinion? You know, if somebody uses only VA, they're only going to be able to go to VA. So I typically advise people to take Part B. It's a pretty cheap insurance. And then we can partner something up like a Medicare Advantage only. And you can either look at like the Humana Honor Plan. They actually do these for people with VA and TRICARE benefits. But like we use the United Healthcare one quite a bit. We also use back the Patriot Give Back one. It actually gives back $150 on the Part B premium. So if you remember me talking about, everybody has to elect to have Part B. So let's say that person really doesn't want Part B. Well, they could take Part B at $174, do the WellCare Patriot Give Back program, and it's only going to cost them $25 for Part B. Not
Wow.
bad.
That's not bad. That's awesome.
Yeah. So we use these for marketing tools as well. So, we help people get into the American Legion, VFWs, and really make a marketing plan for each individual agent. Okay. And I think that's really important because every agent's going to market just a little bit differently, and want to do things differently. But let's go back to having fun, right? I remember when I was first a farmer's agent, I got to go out into the community and have events and things like that instead of, I never did the cold calling thing very much, right? I really didn't care for internet leads. Some people love them, love sitting in their office and cold calling. Whatever you want to do. We have agents all over. We have agents that do nothing but sell from the phone. So any questions on the technology?
Nope, but
Okay.
Vaughn said dental is not covered under the VA Benny, so dental would be great.
Absolutely. So dental is not, people with TRICARE, they don't have dental or vision or hearing either. So it's a really good benefit. So a lot of times, give you guys how I saw it. I'm like, hey, with people with VA, I'm like, hey, you keep doing what you're doing. Just keep going to the VA. But we got this sitting in our back pocket in case we need a second opinion, right? Okay. So what makes Invictus different? Okay. I think the biggest thing is we've been in your shoes, right? Travis and I both, and Mark, have been in that position where we've taken 30, 50, 80% rate, 110% rate. We've been there, declines, cancels, things like that. Okay. So we know what it's like to be in a property and casualty agency. Okay. We're not telling you to put that on hold. We're just telling you to do this in addition to, right? So mind your book of business. Watch for people coming into your office that are moving in there that their birthday is 1959 or older, right? So those are the people that we can that's like free money coming in the door, right, Mark? So,
Absolutely. Yeah.
The other thing is we offer the mentor coaching to grow your agency, right? So this may not be for you as the agency owner. Let us help you find somebody or find somebody. Let us train that person, right? Expand your agency. Those people are in there. You guys, a lot of you have been doing this for a really long time. You've got a book of business that people are active and inactive, and that may have left you because of the carrier, not because of you, right? So let us help you grow your agency. We're not going to just throw products at you and say good luck. Okay, that's the thing that I think is really valuable too. We've been in your shoes. We've always had sales managers come to us and say, "Hey, it's just this easy," and they've never sold before in their life. Okay, that's where we set ourselves different. Mark, Travis, Cody, and I have sat across from the kitchen table with people. We know what their objections are going to be, right? Probably before they say it. Like I said, marketing plans for each individual agent. Okay. I think this is really important too. Okay. So, I used to have managers come to me and like, hey, buy these internet leads, and then, Allstate buys them, your independent broker buys them, farmers people buy them, and there's just these old recycled leads. All three of us on this call as agency owners have grown our business on the Medicare Supplement side and cross-sold back to the property and casualty. Okay, Mark. Mark, do you mind sharing just a little bit about how you've grown the property and casualty over the past few years off of your Medicare sales?
Yeah, sure. The biggest surprise for me was when Scott had introduced me to the Medicare side of it. We really looked at that as really just another revenue stream. And, that took off pretty quick. And so we were very excited about that. But what I was not counting on is how much cross-selling into the PNC side of our business we were actually going to get. I would say 60% of our PNC business today comes from our Medicare side of it. So whenever we complete a Medicare sale and then ask them about their PNC, quite a few folks give us the opportunity to quote them. And then, everybody understands that the more products in a household, the stickier all the business gets. And so, it's just been a really, like I said earlier, a really great organic way to grow our property and casualty alongside, and especially in a hard market, right? Because, we're all looking for different avenues. So it's kind of the perfect storm, guys. I mean, it really is to be able to add revenue and also add other lines to your book of business.
Thank you, Mark. Another cool thing is, as Noah has willing to, along with us, co-op leads, right? I've talked with everybody, and so like if you're wanting to work leads, we can help you with lead drops. We'll never ask you to buy something or a lead that we haven't tried out first. Okay, so we always try to. I don't want to ask you to spend $5,000-$10,000 and it doesn't work out for you. We want you to be able to profit on that. So.
And I have reports in Epic.
That's right. That's right.
Help you to start off with.
I mean, get in front of the people that you know already that you feel comfortable
Right.
with. Absolutely. Thank you, Laura.
Scott, that's what we did. We ran that report and we got comfortable. They knew us, we knew them, and it's just low hanging fruit.
Yeah.
For
Mark, I think, like kind of going back to when you first started, on the Medicare side of things, it was kind of a good refresher of getting in front of people again, right? I mean,
Oh yeah.
Get to know your people even more intimate. I think health insurance is very intimate. I mean, they seem to have this other level of trust when you help them out with their doctors and their drugs, and they tell you their problems and things like that, even more than on the property casualty side.
Well, and I think that's a good point. And I think from a referral standpoint, they're going to give you 5-to-1 on the referral side for Medicare than they ever will on the PNC side.
Absolutely.
It's just something that they have a care about. They're talking to their friends about, about their health insurance and things like that. And so, well, who do you use? Well, I use this guy. You need to call him. And again, we're able to then move a lot of those into the PNC side anyway. So.
Yep. That's such a good point. I think Travis says this all the time, but how many people, when you ask them for a referral on the auto and home side, actually refer? But people on Medicare, they all hang out together. They have nothing else to do. Besides like talk about who their Medicare person is, what doctors they go to, but they're like, oh well, you got to go see my guy. And when they're playing golf or drinking coffee together, or so
Playing
pickleball now.
Yeah.
Or bunko.
Pickleball.
Yeah.
Pickleball now, right?
Yeah.
That's right.
Teresa said that the big supplement person in her area retired, so she's
There you go.
new
Perfect.
in that area.
Perfect. Now's the time to take some business.
That's right.
All right. So next steps is going to be complete the agent jot form. So we have a jot form. We're going to gather some information from you. We're going to request contracting, and one of our contracting specialists will reach out to you to help complete that contracting. Okay. The biggest thing I think where people get overwhelmed is they try to add this on and they don't actually schedule a time for to take the certification and tests and things like that. Guys, I'm with you too. I mean, like right now I'm taking a Social Security certification and it's 5 modules long, and I just have to schedule time to actually get it done. Okay, so I'm with you. I'm continually trying to learn more. And I'm trying to get this designation as well. But we need to schedule a time for AHIP. Okay, so if we like, hey, I'm going to do this after work, it typically isn't going to happen. Schedule a time for company-specific certifications, and then we'll schedule an appointment with you on an individual basis to do a little bit of one-on-one Medicare training. Mark and I, we were up in Chicago with everybody last week, and they've graciously, they said we were going to try to help put on a in-person class as well. So if you don't mind, if you want to come to the in-person class in Chicago, which we usually put about a 2-day class on, we'll probably do something fun at night, just to get to know each other. This is a relationship business, guys. We have a higher success rate of if you take an in-person class. I promise you. We have about a 600% better return for you guys for an in-person class. Okay.
Yeah, come on to Chicago. Come hang
yes,
out.
I love Chicago. All right. So we'll do the individual. Put in the comments if you're interested at all or in the chat at all if you want to come to that class. It gives us a little bit of interest of how big of a room we need. And then once we get all that done, we're going to run our reports on our 64 plus clients and then start winning, right? We need to get you some wins. I would love to, and I've got a commitment. We were at a conference and I have a commitment. I told Nick and Mike and Joe and Maggie that I want to commit to 45 days to get you guys going. Okay. So from the time that you say, yes, I want to go, I will help you if you get these certifications done to get your first sale in 45 days. Okay. So you'll learn something about me and Travis and Mark. We're all in. All right. So if you're all in, we're all in. And I promise we will help you. If you have questions after this webinar, feel free to shoot us an email. You can call my cell phone. You can call Mark's cell phone. My cell phone is 573-619-6670. I'll put that in the chat as well. And like I said, if you're wanting to reach out, whatever, we'll help you get up and going. So,
What's the cost, Scott?
So putting that together, aren't you?
we're still putting that together. So probably it depends on if we have to get a room or not. So it's gonna.
Teresa, are you asking what the cost is to sign up with Invictus for the training or both? Okay.
Both. Okay. So the in-person training, I will get more details on that. You'll just be responsible for your training. We may have to charge something for the room and, with whatever we do. But as far as like the cost for the training or to sign up with Invictus, you're just got to pay for your AHIP, which is going to be $125. We get you a $50 discount code. And really, that's going to be your only cost unless you want to add states and then state appointment fees. So we don't charge you anything. Probably not used to that either.
No, not at all. And Mark, you got to bring Paula with you when you come out.
Oh my goodness. I think that could happen.
That's awesome.
All right, guys. Any questions? We can open it. Oh, I'm so sorry. I'm putting my. Okay. We've got a few testimonials here from fellow agents, but we actually have one on the call today, and we asked him to do a shameless plug for us. But we've known Eric for a while now. So, Laura, can you make him a panelist?
I am. Just click the link. All right, Eric, now you can turn your camera on if you would like.
There he is.
Hi guys, how are you today?
Good, Eric. Nice to see you.
Good,
Hey,
good to
Eric.
see everybody. Really enjoyed the presentation. Thank you guys so much. I've started with Invictus a couple years ago. I kind of been through my first cycle. I got in a little bit late, so I would recommend getting started early. The first year I didn't really get my ready to sell letters or notifications till halfway through open enrollment. So getting it done early is the main thing for sure. Last year, still had a good year. Last year was a better year for me, and I think I can just see everything progressing as we work the Medicare side of everything. We're still a full PNC agency, but we're working the Medicare every year a lot better. And you start seeing the renewals coming in as they were talking about the commission, the renewals. So that really helps on the backside. Invictus has been wonderful to work with, the whole team. Anytime I've had a question or something, I don't hesitate to call Mark or Cody or Scott, and they get back to me really fast and get everything answered for me. Getting set up was, they made it really easy. Getting contracted, it does take a little bit of time. It's kind of daunting at first, but it's just getting in and getting down to it. And once you understand what's going on, it's easier the second year. So anyway, I've loved working with all of them. Oh, I mentioned Travis too. I didn't mention Travis, but he's been great to work with as well. So anyway, love working with Invictus. They do a great job. And anyway, that's kind of my plug for you guys. I really appreciate the time.
Well,
Thank
Eric,
you.
how did you get started? You just went in, you jumped in, you took and got certified. Did you use your current book of business to reach out to?
I did a little bit of that. Kind of in my first year, I was in the throes. I bought a small agency, actually pretty close to Mark's office in Camdenton. And about a third of that agency was already Medicare. So that really kind of threw me into the fire. I had to learn it pretty quick because when open enrollment started, all those folks started coming into the office because they want to review everything every year. And it just, I don't know, it's kind of like drinking from a fire hose that first year, but it really made me kind of really dig in and learn as much as I could about the Medicare side because I knew really nothing until I just kind of started the training process.
So would
I-
you say your year two was much better than year one because you were getting your
Year
feedback?
two, I was much more comfortable. Was easier to talk to people because I was more comfortable with the products. The Medicare Center site is awesome because you can just roll right in there with a client and put all of their prescription drugs in, find out who their doctors are, and it just spits out the information. And you can get to the Medicare sub side that way too. So that's a lifesaver, really. It really is because it's got all the information that you need in there.
It's pretty conversational too, isn't it, Eric? So like,
I'm sorry.
it's conversational, so you can.
It is. It is. I just turn it around and go through it with my clients right at my desk, or if I'm on a call, I got it on my laptop and they can see everything right there. I have nothing to hide. Those are the numbers. That's where it's at. Most of the clients, they kind of know as much about Medicare in some instances as you do. So they're looking just to make sure their coverage is right. That's their biggest concern.
So,
Hey, Eric,
Levon- oh, go ahead.
I'm sorry, Laura. I was just going to say, I saw a question come up. It said, how much service work did you have? That's something you and I've talked about a lot. I mean, how would you compare the service work to Medicare versus your PNC?
There's literally hardly any service work. I get clients coming in or calling, after you get a policy put together for them, just to make sure that they get their cards and they get their stuff in the mail, things like that. But really, there's hardly anything to it as far as service work goes. It's really easy. So,
Yeah.
That's awesome.
mhm.
Mark, you think the same thing?
Yeah, absolutely. I mean, that's probably another surprise, because we all know on the PNC side, there's quite a bit, and
Understatement.
so
Yeah.
yeah, so it's something that if you're asking somebody to bring another revenue stream on, that's one thing, but when you can say, hey, you can do that without having to really amp up a lot of service work, that's like cherry on top. So
Yeah.
So I've heard some agents have said before, hey, we're in this crazy hard market. I'm so busy. What would you say to somebody that's just saying, I'm so busy, I can't do this right now?
I'd say do it because you're busy. You kind of got to block off that last the open enrollment period. And I kind of made a mistake last year and forgot when it was and went on vacation the first week. But it's you really have to, you could make, but if I didn't do something during open enrollment or find out that, they don't turn 65 till next year, I made a lot of appointments or contacts for the following year. So you're busy during open enrollment, but you can continue out throughout the whole year. So it's not as busy for me has been throughout the year, but I need to do a better job at marketing it all year long. So.
And Scott, do you help with any kind of marketing ideas for that?
Yeah, absolutely. We've got letters, we've got scripts, we've got, if it's been done, we've tried it, right? And so like, again, like I won't have you do something that I don't think is going to be beneficial for you. But yeah, I mean, like Eric and I kind of already talked a little bit of strategy for AEP last week, of what we need to come up with. We try to figure out what's hot in your market, right? So, okay, hey, one thing that I realized a really long time ago is insurance is a niche market or niche or whatever, how you want to say it, right? But like, hey, certain carriers want certain people. Same thing on the Medicare side of things, I mean, let's do some VA marketing. Let's do some dual marketing. Let's do some turning 65 marketing, and let's do a lot of all of it and get as many people in the door as we possibly can. So.
Yeah, that's awesome. And then if you're using a CRM, you can have those automatically generate those emails out for you.
Yep. Yeah. If you're using a workflow or something like that, but I think one thing I think the easiest thing and that I'll leave you with as far as marketing wise goes is run that, like you said, see the opportunity in your own book of business and call those people that and all you have to say is, I bet your mailbox is being bombarded right now. Don't say another word. And they'll go, oh my God, yes. Well, I tell you what, how about you come in and I'll show you all your options on Medicare. I've got all your Medicare Advantage, Medicare Supplement, and Part D plans. Let me sit down and show you all your options. We'll take that off the table.
And another point, Scott, is from a, perspective of people not being overwhelmed. Most areas, there's generally 2 to 3, Medicare Advantage companies and 2 to 3 supplement companies that you need to kind of just get your feet wet and get started. And then as you grow in the business and you need to add a carrier here, add a carrier there, very easy to do. So I think one takeaway is don't feel like you got to go out and get licensed with 14 different companies right out of the gate to have a start. I know I did not do that. I know, Eric, you did not do that, and, did just fine.
Yeah.
Okay, we got another question. Barbara says, I have a plan G. If I switch during enrollment period, will I find that the plans are standard, but premium varies from company to company?
Yes, Barbara, the Plan G is a Plan G, no matter if it's with Humana, United, ACE, Manhattan, whatever carrier it is, right? Back in 2010, they standardized all Medicare supplement plans to where a Plan F's a Plan F, a Plan G is a Plan G. So, yep. So we just, our deciding factor is premium.
Okay.
Sorry, I just want to say, the thing I always tell people when I know Scott says this too, I may have learned it from him, but you get that pushback on like, well, Mutual of Omaha is the best, or big one is Blue Cross Blue Shield. Everyone's gonna say that they're the best. I say the only difference you're gonna see in these plans is the logo on the card and how much money we're gonna save you. That works every time. So
yeah, that's great, Cody. Yeah,
that is great, Cody. But Scott, you need to record that. Something I learned from my dad.
Right.
Wow.
That's all right. I got this recorded. Thank you, Laura. So every time I just need that little snippet that.
Yep, I'll give that to you. Just that.
Can you put that in a TikTok? I'm sure I'll get lots of views.
Yeah,
Hey,
that's right. That's right.
Real quick, I'm just going to share my little thing of how I got into it, because I had doubts too. I didn't want to make time. I didn't have time. I was a PNC agent. I struggled with how do I form my staff? How do I get paid? How do I keep everything going? I saw what other agents I knew were doing, Scott, so a few other people come to mind, but I bought in myself. I got licensed, registered, and I made a goal of, I think it's $12,000 in open enrollment. 12, 13, 14 years ago, that was, we had to write a lot more to get to 12,000 than you do now. But with that, I decided I was going to hire an office manager. I was going to set X amount aside that would get me through at least 4 to 6 months. And then by then I have them up in training where, we can really start making more money on the P&C side. Fast forward, I ended up making 15,000. I overshot my goal. But the thing is, we can make small goals. We're P&C agents at heart. We know the game. One thing about P&C is we're taught how to run an office. We're taught how to manage people. Guys, this is a great opportunity for the staff. When I did this, believe it or not, I allowed me to grow my agency because I used the Medicare money as my personal money, what I lived on. And I allowed me to put everything back into my agency for staff. When I sold my independent side, I had 13 sub-producers throughout the state of Missouri, did 100 and some thousand new business. I mean, for some of you, that's a lot. For some of you, that's just a regular Tuesday, but I allowed the growth of my agency from this. And it gets fun when those renewals start coming. Guys, you just have to buy in and make a realistic goal that first year and commit to yourself. All right. And we're going to be here with you. I promise.
Thanks, Travis. All right. Anybody else have any other questions?
So I see a comment in here from Levon. So customer service responsiveness to issues is a critical factor. Absolutely. At heart, we are property and casualty agents. We know how the service industry works. When you do have a service issue, or let's just say somebody needs cards or something like that, we do a lot of three-way calls, to United, to Humana, with the client. You'd be surprised how much that helps. There's a lot of times there's nothing we can do. We have to have them on the line because of HIPAA, but it really helps them a lot because they're afraid to talk to people, and I can be working at the same time as I'm on a three-way call, getting them cards or changing their primary care doctor, or if there is a billing issue or something like that. But we've got a pretty large agency here, and like I said, the service is very minimal. So
outstanding. Thank you for that. All right, we are right at time. Eric, you got anything you wanted to end with?
I'd say if you're willing to do it, step in and do it because it'll benefit your agency in the long run for sure. Yeah, give it a shot.
Thanks, Eric. How about you, Mark?
Yeah, I mean, it's just been the best thing that we've ever done to grow our PNC shop and to grow really at the end of the day, not just a small revenue stream, but a very large revenue stream. We've been very blessed. So thankful I got a chance to meet Scott and Travis when I did. And it's just been something that I really enjoy doing. And it's been just a good thing all the way around.
Thanks, Mark. Cody, anything you wanted to jump in?
Yeah. So this probably doesn't apply to a lot of you because you're all wonderful salespeople. I am not as gifted at sales as my dad is. So I like Medicare because you take the sales part almost out of it and you become an advisor ready to help people. And I think that's what's really cool about this.
mm-hmm.
Yeah, that was great, Cody.
Yeah,
it certainly was. Travis, anything else to wrap up with?
For those people that are looking for referrals, they talk. I used to save people $12,000 a year on their home and auto. That's for referral, and it was crickets. They sit at coffee shops and they like to brag at what they're getting. Also, it's a great segue into those of you, I don't know if anybody's security license, but for annuities, life insurance, it's an easy transition to that. And I know a lot of agents that make a lot of money just by asking the simple questions, and they lead with Medicare. So,
yep.
For
Excellent
sure.
point, Travis.
Yeah, very good points. How about you, Scott?
My last thing is I see some go Bills and go Vikings.
I held my tongue there.
In the chat. So I love a little friendly rivalry. So I'm looking forward to the season coming up. So Laura, are you a Bears fan?
Oh, I am.
We'll see. We'll see.
Right. They don't do
hope-
very well.
I hope you guys have a good season. But no, I want to thank everybody for coming. You know, like I said, I hope to see you guys soon. I'd love to do it in person, but if not, we'll get you guys going. We've got some stuff on the LMS. We're going to continue to add more and more content to there. Go like us on invictusagents.com. Once you get some business with us, we'll get you a login. You can watch videos. You can do all that kind of good stuff as well. And again, feel free to reach out to us. You know, if you start this and you get stuck, we don't know if you're stuck. Okay, reach out to us. If you're stuck, reach out to me, Mark, Travis, or Cody. I know even if you reached out to Eric would, you know, try to point you in the right direction. So, but I really appreciate everybody being on here today. So,
Well, thank
Thanks,
you
Laura.
very much. Well, thank you everybody for jumping on today. In the chat, Cody had put Scott's phone number. If you could go back to that slide, Scott, with the other phone numbers. If
yes.
you would like to go ahead and, you know, screenshot it, take a picture of it with your phone, you can always reach out to me if you have any questions, or I can get you in contact with the guys here. All right, everybody, have a great rest of your day. Have a great week, and we will talk with you soon.
You
Thanks,
too.
guys.
Thanks.
Next
Thank
webinar.
you.
Thanks.
Thanks.
All right, bye,
I don't know if
guys.
we have socials
Bye-bye.
or not yet. The addresses we can probably get. Bye, buddy.